I'm Dr. B.
Josh.
Hi, Josh. This is my scribe, Kay. He's going to be helping me out today. Tell me what brought you in to see us.
About 3 hours ago, all of a sudden, I felt really lightheaded, and felt like my heart was racing, and I thought I was about to pass out.
Okay. Have you ever had anything like this before?
I've had one previous episode where it felt like my heart was racing, and I was gonna go to the ER. I was actually on my way there, and my symptoms just kind of went away, so I decided to turn around and drive home.
Okay. Was there anything that you did today, like drink caffeine or go running or anything that could have precipitated this event? Palpitations?
I did have a 5-hour energy this morning.
Okay. Have you had any other symptoms like shortness of breath?
Not really.
Any nausea, chest pain?
No chest pain, but my chest does feel a little uncomfortable. Just feels like, I don't know, my heart just feels like it's racing.
Okay. But not really a pain?
No.
Okay. Have you had any stomach pain?
No.
Any diarrhea or black tarry stools?
I don't think so.
Okay. No blood in your stool that you've noticed?
No.
Okay. Have you had a fever?
No.
Any runny nose, cough, sore throat, congestion?
Nope.
Any vision changes or weakness in one arm or one leg?
Not that I recall.
Okay. Do you feel weak all over?
I do feel kind of tired, but...
Okay. All right. Any leg pain, leg swelling?
No.
Any recent travel, recent surgery?
No.
Any history of bleeding or clotting disorders, like a DVT or a PE?
No, but I did follow with Dr. Winsky one time, just for some lightheadedness. I saw him once, and then I never really saw him again.
Do you remember what tests they did at the time?
I think maybe a stress test?
Okay. And they didn't think you needed a cath?
I don't think so.
Okay. All right. How long ago was that?
I think that was about 3 years ago.
Okay. And everything's been fine since then until recently?
For the most part.
Okay. What were you doing when you started having these symptoms?
I was just walking up the stairs.
Okay. Do you feel like exertion makes it worse?
A little bit, yeah.
Okay. Okay. Well, just going to do a physical exam here.
I guess I should probably also mention I do have diabetes,
Okay.
and I had rheumatic fever when I was a child.
Okay.
I don't know if that's important.
Yeah, it's always important to know things like that. I appreciate you letting me know. Have your sugars been well controlled?
I don't usually take them very often.
Okay, because sometimes if you have low blood glucose, that can make you have palpitations. Did you have any sweating?
Yeah, a little bit.
Okay. And also, rheumatoid fever can make you at risk for heart problems too, so it's good that you saw Dr. Winsky. I'm just going to have a look here. Your blood pressure usually okay?
Actually, I do have high blood pressure as well.
Okay. Do you take medicine for it?
I'm supposed to, but I don't.
Okay, so if you have high blood pressure and you don't take any medicine for it, that makes you at higher risk for heart attack and stroke. So even though you may not have having any symptoms from that, you do want to prevent a heart attack and stroke. So we'll have to talk to Dr. Winsky about getting you back on something if it's high. Let me see your mouth. Okay. So his posterior oropharynx is clear. I was unable to visualize his optic fundus. I do not feel any lymph node swelling. Take a deep breath and hold it. No carotid bruit. Breathe. He is tachycardic. It looks like on the monitor he's about 150. I'd say he's irregularly irregular as well. Can you lean forward for me, please? His neck is supple. Take a deep breath. And deep breath. Deep breath. I'd say he's a little diminished at the bases, but otherwise clear. No abdominal bruit. Can I see the wrist, please? He does have equal radial pulses bilaterally. And no abdominal tenderness. Any pain when I squeeze your leg there?
No.
No? Negative Homan sign. And he has just trace edema in bilateral lower extremity. Probably what we'll do is if you feel like you're going to have a bowel movement, we'll check your stool for blood. I just want to make sure you don't have any internal bleeding. I need to figure out the cause of your heart rate being so fast, and there are several different causes. I'm going to have you put in some orders for me. We'll go ahead and get a stool guaiac, thyroid function test, so we'll get a TSH with a reflex T4. I'd like to get a troponin, CBC, BMP. Let's go ahead and add a magnesium and a phosphorus level, and then maybe give him an aspirin. Do you have any other questions or concerns?
Not at this time.
Also, add a chest x-ray as well.